I have the distinct pleasure of introducing somebody I would now call a friend who, we've never actually met in person. Frankly, I haven't met Beverly and I haven't met Val in person either, but I think this is how we've learned to adapt and overcome some of the challenges and use technology as a great way to connect and share information like we are today, but recognize that it's a supplement to the human interactions that make us happy and healthy. I get the opportunity to introduce Dr. Kiffer Card, who is the scientific director of the Institute for Social Connection and an assistant professor with the Faculty of Health Sciences at Simon Fraser University. He's a behavioral epidemiologist, social ecologist, and health services researcher focused on the ecological, political, and social determinants of health, with an emphasis on understanding how emotional distress and coping responses impact health, well-being, and equity. He's also the chair of the scientific advisory panel for the GenWell project. Ladies and gentlemen, my friend, the person who has been such a partner and a colleague in championing the human connection movement, who's going to take us through the results of the Canadian Social Connection Survey, Dr. Kiffer Card.
Thank you, Pete. It's a privilege to be presenting to all of you on our data from the Canadian Social Connection Survey. I've got our slides up and ready to go. As we begin, I just want to start with an acknowledgement that I'm joining from the land of the Songhees Nation of the Lekwungen speaking people in beautiful Victoria, British Columbia. So good, a little early to be with you, but we do wake up here in BC, and it's good to be here. As Beverly talked about, I think one of the profound importances of studying social connection, why we launched the Social Connection Survey, is because loneliness kills. If you think about that, that's a really profound statement, to think that our social relationships, that people are literally dying earlier, and not just in ways in terms of shorter lifespans, but increasing rates of suicide and those sorts of issues. Really highlight the critical issues that are associated with languishing and being alone, and how critical it is for us to find those connections. Studies going back to the 80s have demonstrated this, but yet we're not seeing the uptake of this information in a way that is changing policy and changing how Canadians think about social connection. When you look at the mechanisms that link social connection to morbidity and mortality, so the ways that it shortens your life, it's important to remember that these are complex pathways. There's both these physical pathways where being lonely causes stress, and that stress causes inflammation and poorer immune response. But there's also a bit of a cyclical feedback process. You don't need to absorb all this content on the slide here, but when you're lonely and socially isolated, you become vigilant to social threats, which causes you to withdraw and isolate yourself more. And so it's really a sort of sticky condition in which this feedback loop creates an ongoing problem for people with stress. And that's why interventions and wake-up calls to help Canadians improve their social connection are so critical. In addition to the individual level harms, loneliness isn't just bad for you, but it's bad for our society. We're finding that as increasing loneliness takes hold in our society, driven by strains of individualism, we're finding that that is fueling populism, that it fuels things like alt-right wing terrorism, in terms of people feeling isolated, finding communities online where they believe but feel included in those radical things. And so making sure that we have happy and healthy communities is a critical response, not only for individuals, but for our communities and our society. If you look over the course of the pandemic, loneliness and social isolation is increasing. On the screen here is some Google Trends data that we looked at, just looking at the early pandemic period, how much more concern did people have? And I think one of the critical trends that we see is increasing levels of people living alone, but also people more wanting to know, how do you make friends, and being concerned about the issues of loneliness. And so I think these are critical thoughts that are on people's minds in the context of COVID-19, and therefore is a big motive of why we've teamed up with the GenWell project to really start to understand what is the level of loneliness, what can we do with it, and what can we do from a health policy system response. And so the aims of the Canadian Social Connection Survey, and what I'll share with you today, are to monitor the trends in social health and subjective well-being, to identify patterns of social connection that are associated with improved health and subjective well-being, and to understand facilitators and barriers to social connection. So the Canadian Social Connection Survey is actually a series of surveys. We're funded by the Canadian Institutes for Health Research and the Michael Smith Health Research BC to look at post-pandemic recovery. As I mentioned, the COVID pandemic has posed a critical barrier to social inclusion for many. Not only are people worried about COVID-19 and the infection that has, but associated lockdowns during the pandemic period also appear to have an effect. And as what we're seeing is that as we follow people over time, we'll hopefully be able to understand better what causes that loneliness and social isolation and monitor how they're improving. And so we launched the 2021 Canadian Social Connection Survey. We followed people over time in a 2022 cohort, and then we launched a new 2022 cross-section of the survey. And so this will allow us to monitor trends between and within people. So how an individual themselves changes will be evaluated in the cohort data, and then how populations are changing will be evaluated using these serial cross-sections that'll continue up until 2024, and hopefully thereafter. So we pulled out a number of lessons from what we're seeing in these various data sources. The first is that Canada has seen some minor and modest improvements to our social and health and well-being over the past year. Many people have thought that, after the pandemic ends, everything will be fine, we'll be happy, our mental health will be back, we'll be back to connecting socially. But as I said, those are modest and moderate improvements. When you start to look at any number of indicators, we see that the improvements aren't what we'd want to be. So if you look here, we have a series of box plots. The lines here in the middle demonstrate the average kind of level of score. And then the kind of bulk of the data is there contained in the box. And so you see on subjective happiness scale scores, you see on life satisfaction scores, you see on burnout, that overall, we're not seeing these huge dramatic increases. Most of the data still lies in the same portion. So if you're taking something like burnout, which we know we've recently published a study showing that the number one driver of burnout is emotional loneliness. It's among, of all the variables we looked at, the most important. That was 35.8% in 2022. If you go back to baseline, it was 40.8%. So this is in the cohort. So really only a 5% discrepancy between over the past year. So we have not recovered from the pandemic in the way that we hoped we would. These are still quite high. The same is true for mental health. If you look at anxiety scores and depression scores, you've seen some improvements, but still the average level of anxiety is about the same. You do see modest improvements in depression, but again, the bulk of the data still appears to be kind of in that range. And if you break this down in terms of diagnosing individuals, 33.8% this year compared to 39.7% last year is not the level of improvements that I think we're hoping to see. We see that this is also across measures of loneliness. We look at emotional and social loneliness measured either using the UCLA scale or the Dzong social loneliness scale, an emotional loneliness scale, or existential loneliness scale. And again, you see some improvements, but not dramatically large ones. A large proportion of people are still feeling lonely. In fact, when you ask people subjectively in our 2022 survey how much they feel lonely, 51% actually said they feel more lonely than they did last year. So an actual increase in loneliness. And if you add that to the 2021 data, in which we heard from people saying that they felt, 65% felt more lonely compared to before the pandemic, we are seeing that people continue to stack in their experience in terms of feeling loneliness. Here in these woods, we also look at social support as a key indicator. So emotional loneliness is different from social support. You can be surrounded by people and not feel supported or you can feel lonely. And so it's important to measure these lots of different ways. And I think, our original statement, while we're seeing modest improvements, they're probably not as good as what we would like them to be. And the subjective experience that people are reporting is that they are still feeling either about the same lonely or more lonely. Only 10% were less lonely. And I think that's really reflected in the survey data that we collect. Our second lesson is that Canadians are continued to struggle with getting the social connections that they need. Of course, this varies by activity. But here in this graph, we chart the prevalence of social activities over the past month. And so along the bottom, you can see the proportion who was hugged. in 2022, which is orange, versus 2021. And as what we actually see is that across many of these, people are actually less connected, whether you're looking at the cohort data, which is the light line, or the cross-sectional data, which is the dark orange line. You see that people across many of these indicators are actually getting less social connection now than they were a year ago during the lockdowns. Why might that be? Well, during the lockdowns, we all knew how important it was for us to go out and get these social connections. So we were maybe doing those things like going on walks, making new friends, doing video chats, finding group work, doing volunteer games nights, those sorts of things. But again, we have not kept up with that in the wake of the pandemic, and so that's really concerning to me that it's something that we're putting off to the side as we deal with other struggles and the other hustles and bustles of life, which is fine, but it is concerning. The third lesson was that a large proportion of us are still experiencing loneliness, and about half of those who are lonely are chronically lonely. If you look prior to the pandemic, Angus Reid estimated that only about 22% of Canadians feel fully connected and supported. So, not good, I would assume most of us would feel. And when you look at that in the context of our data, we look at this issue of about 43% of people are classified as being lonely. And about half of those who are classified as being lonely, about half of them are chronically lonely, meaning they experience continual loneliness and social isolation on an ongoing basis. When we ask people, how many people do you know who are chronically lonely? 70% of us know somebody who experiences loneliness on this ongoing basis. And so the solution, I think, is with us, reaching out to each other and building those social relationships to address loneliness and social isolation, particularly that is chronic. Because all of us at some points in our life, I think, feel lonely. You might feel lonely because you didn't go out with your friends one night and you feel a little bit of FOMO and you're worried about missing out on things. You might feel lonely because you've recently exited a relationship or your partner's away traveling. But all of those things are passing loneliness. I think is what we are concerned with in terms of the health and social effects are these chronic levels of loneliness and preventing that, ensuring that people don't fall into this category of being chronically lonely. But we know that in large part we are failing. Approximately 20% of people in our surveys seem to be meeting that. The fourth lesson is that we see that while older, white, able-bodied, and wealthier individuals experience less loneliness, changes in loneliness are fairly equal across many groups, with important exceptions related to socioeconomic status and disability. So you can see in these interaction plots that the effect of age is important. We see that obviously those who are 65 or older, who have been the focus of much of the existing research on loneliness and social isolation, were actually the least lonely group, and that young people aged 16 to 24 and 25 to 44 had the highest levels of loneliness. The trends of loneliness are about the same for these groups. These aren't statistically significant differences in terms of the trend, but they are between the groups. Similarly, when you look to gender, both men and women between last year and this year are seeing improvements across these cross-sectional surveys. And so we are seeing that people are improving, but, and this is in terms of emotional loneliness, but they're improving about similar rates. Is where we do see a difference is on income. High income people have apparently been able to lower the slope of their, they've been able to improve their loneliness between 2021 and 2022. Of course, if you have money, you can go out and do things with friends and that sort of thing. So that kind of makes sense. But the factor that we see as one of the biggest determining factors is the issue of disability. If you look at and compare people with disabilities to without disabilities, you see that those without disabilities have been able to lower their loneliness between 21 and 22 at a much quicker pace than those who are, who are experiencing disability. And so I think this highlights the importance of being able to reach out and build healthy communities. So when people do experience hardship, when they experience disability or isolation or loss of job or have income troubles, that they have a supportive community there to catch them as a bit of a social safety net. When you look at this issue of who is playing a role, I think it's important to recognize that we have fairly diverse social networks in Canada. Of course, in terms of our socioeconomic status and neighborhood, you can imagine that a lot of people tend to group, and we do see that we do have people with the same shared characteristics. but we are broadly going across all of these characteristics and socializing with people of opposite genders, sexual orientations, age, political beliefs, religious beliefs, and same neighborhoods. And so there is a lot of positives in this data as well. So we don't want to just undermine that it's all bad. But lesson 5 for frequent social connections, we found that having more social connections is associated with less loneliness. And so we wanted to know about what are the different social connections in terms of their relative benefit. If I'm a person and I get to choose between, going out with friends or staying home and having a conversation, what should I do in terms of social life? And so we looked at their effect on loneliness, and we kind of get these 4 groupings. So those that have the strongest. So if you do these top grouping of things more frequently, you can see, for example, talking with someone about your or their hobbies. That's associated with a 72% reduction in the odds of being lonely. Playing board games with others, that's a 66%. Talking about how people's day, their family, greeting a neighbor or acquaintance, those are really high impact things. If you're just having those casual conversations, sometimes this is described in the sociology research as weak ties, right? If you're doing informal things, then that really seems to be a lot. So those cost barriers in terms of, not wanting to go out to a bar, or restaurant, or club all the time, or movie to pay for those things aren't necessarily even the most high impact activities. Sometimes the most high impact activities, it seems, is just having that person to person connection, a board game at night, having a conversation with somebody close to you. We then see that there's another grouping that are slightly less impactful, but still important. And we see that things like making new friends, meeting friends for coffee, going out and talking about people's work, having kissing folks, going for walks, those sorts of activities that are listed here are associated with between a 25 and 49% lower odds. And this is for each 1 point in frequency. So that's going from, doing this daily or multiple times a day to doing it, a couple times a week to weekly, a couple times a month to monthly, and so on. So these things really do seem to be quite effective. Where we see less effect for is online sort of activities. So group and video chats, text messaging, playing online games with others. Those seem to have a lower effect, between 0 and 24% decrease in odds for each 1 point being lonely. And then there are some things that weren't statistically significant, so they're not associated with being lonely. So, things like volunteering, text messaging, again, online group discussions, computer and console games, and those sorts of things. So based on that data, we wanted to look at, okay, what activities have kind of the most optimal impact? If we're going to perform them daily or weekly or a few times a month, what is the optimal frequency of doing these various types of activities? And so we did some complex regression, and basically we were able to look at their effect on loneliness and where, in terms of the level of frequency, do they have their greatest effect. And so just because something's categorized as daily or almost daily doesn't mean you shouldn't do it a few times a week. It just means it was best done, had the greatest effect on loneliness when it was done daily or almost daily. So the activities that were best done daily or almost daily in terms of their greatest effect on loneliness was having conversations with others, phoning, texting, hugging, kissing, sex, playing online games. So doing those sorts of things daily or almost daily is really important. I think one that might stand out to a lot of you is playing online games, right? We actually don't see that lower levels of frequencies of online gaming actually have much benefit in terms of loneliness, except for when it's done daily or almost daily. Why? Because people, no matter what activity you're doing, if you're finding community there, if you're connecting with people, as online game environments may allow individuals to do, then you're able to have that social connection. And so I think that's an important lesson to take, that while we do try to give some good advice on, what social connections are best, that's going to vary by person. It's going to vary by circumstance. And really it matters about the content of the social connections that you're building and how it fills you. In terms of things we should do a few times a week, online forums and discussions, video chats, work meetings, getting together with friends, those have the greatest effect when they were done a few times a week. The things that had the greatest effect when they were done weekly was going out for food and drinks with friends, going for a walk with somebody, groups and video chats with friends and family, visiting family together. Again, things should be done a few times a month: board games, computer and console games, group exercise, helping friends and neighbors, letter or email writing, and making new friends. And those things that are best done on kind of a monthly basis was community volunteering and non-work meetings. And so hopefully this gives you a sense that, to me, these groupings seem natural. They seem somewhat logical. People who might be volunteering on a daily or almost daily basis, sure, they're finding a lot of inclusion and support, but maybe they're also experiencing some burnout from doing those two things too frequently. And so I think this was a very insightful part, that social connection matters, and making sure that we remind ourselves to take the initiative to do those things is really critical for improving our health and well-being. One of the things that I think is critical to think about is people have different preferences about how much to social connect. So it's not just about what my statistics are telling us we should, connect as, but we should also recognize that people themselves are making choices. And so in terms of the things that people want to do more frequently, spending time with friends one-on-ones, going out to coffee and drinks, exercising with friends, having friends over to hang out, those are things that people are wanting to do on average more frequently. Things that they want to do less frequently is go to parties and dance clubs, go to large events, play sports, doing something adventurous. And so really it seems that casual connection, an opportunity to really connect with people, really seems critical. Of course, we recognize there are probably lots of interesting gender differences, age differences, and a lot of different factors that might influence these preferences for social connection. And we hope to use this data to better understand those differences. Lesson 7 was to engage in social activities, you need friends, but not necessarily a million of them. In our data, we asked people how many close friends they have, and 69% have 5 or fewer close friends. And so most people don't have very large social networks. Most of us have a few close friends. In fact, if you look, the mode here, so the most common value is 3 friends. And when you look at the effect of having more friends on being lonely, you really see that once you have 3 or 4 close friends, your loneliness doesn't really increase by adding new friends. And so I think that's really critical to think of in terms of how we're forming our social networks and relationships. If you look at people over time, we ask them, in elementary school, middle school, high school, and currently, we ask millennials, how many friends do you have? And we see that people have a pretty stable number of friendships. About 41% of millennials in this survey had about the same number of friends now as they did in elementary school. And so I think this is somewhat stable across time, but of course, people gain and lose friendships over time, and it's something we should be cognizant of. I think also in terms of the number of close friends that people have by age group, it does differ. You do see that some effect of, for example, Generation X and being different, having harder times making friends, so they have fewer friends as they get older. And I think that speaks to the hustle and bustle of life. We also know that a lot of friendships are made earlier and then become lifelong friends. And there's something about middle-aged life that does seem to be really critical in terms of building and maintaining friendships. Lesson 8. When it comes to making social connection, most friends come from school, work, and through friends. And so thinking about that midlife issue of not being able to make friends, it's important to recognize that, again, most friends are made in school. 25% of those, when we ask people about their close friendships. Other friends, so somebody who knows somebody and you get introduced that way. And then through work, 16% through work. And I think that's really critical to think about, that where people are spending intense amount of times is where they're making friends. You're at school 20, 30 hours a week. You're at work 35 hours a week. You're spending the rest of your time with friends and family. And that's where people tend to make their most friendships. But there are lots of other ways in your neighborhood, clubs or organizations. The strangers, not so much. Seems like coffees and restaurants, people aren't making a lot of friends there. But again, just thinking about where people make friendships and how long people have known friends, again, there seems to be this effect of people tend towards longer term friendships. And so it really adds to that issue around midlife as being a really critical period to understand. Again, contravening the existing research, which tends to focus on older adults and seniors when you're talking about loneliness and social isolation. I think this connects to some recent work that we published from the Canadian Social Connection Survey, looking at the impact of working from home on mental health. And we actually see that hybrid individuals have lower levels of loneliness and higher levels of happiness and better subjective well-being compared to those who only work in home or only work in person. And I think the reason that might be is that when you're only work at home, sure, there are lots of benefits to working at home. But if you're only working at home, you're missing out on some of that opportunity to find friendships, have those casual collisions around the coffee and water cooler, and you're missing out on a big part of where people typically meet and find friendship. We also look in terms of its impact on burnout, and we find that loneliness and social isolation become really critical, important factors, as important as things like physical health and renting. And so, in terms of preventing workplace burnout, loneliness and social connection has to be a priority there too. Lesson 9, social belonging and having a community is more important than having a busy social calendar. If you look at the various ways that people have friendships, some people have no friends, which is not great. Some people have one-on-one friendships, or they have multiple one-on-one friendships. Some people have multiple groups. So you have one group of work friends, one group of school friends. And some people have this sort of one tight-knit core group. And so on the screen here is the percentage of people who are lonely with each of those styles of friendships. And you see that those who are, that have no friends, 78% of them are lonely. That makes sense. But if you look across each, so the more concentrated your social network becomes, the lower levels of loneliness you experience. So people with one-on-one friendships, 65% of them are classified as lonely. Again, this is using standard scales. 62% of those one-on-one who have one-on-one friendships that sometimes interact. 53% of those with multiple friend groups that don't really overlap are lonely. 51% of those with multiple overlapping friend groups are lonely. And 45.7% of those with one friend core group. And so really, this seems to be the most optimal pattern. Of course, different things work for different people, but on average, we see that when people are part of a community where they feel like they belong, where they're part of that, where it's a core group, that's when people have the lowest levels of loneliness. And so again, it goes back to that friendship data we look at. You don't need this large, bustling social network. You need a community where you feel like you belong. And I think that's what's critical to create. If you look at, we ask people, if someone from each of the following groups reached out, how likely would you be to hang out with them? And we see that maybe an important reason for some of this effects on close connections is having the ability to call on people. So you can call on your family, you can call on your friends, you can call on casual workers to say, hey, I need to have some time, I need to hang out, I want to, spend time with you. And they're more likely to respond in a positive manner. They're more likely to hang out with you. Of course, people will call on us, somebody's a stranger or acquaintance and wants to chat, much less likely to actually spend that time. And so I think that's what social capital is being able to call on people to give you that social support and social needs that you need. In terms of the issue of belonging, we looked at just the distribution of how people feel that sense of belonging. We asked how much interest and concern do people show in what you do? And we see that only 10% say none, but the bulk feel a little uncertain some, but a lot of people are missing the a lot, right? And I think that's really important to think about, that we want people in our social networks to know that we have concern for them, and we need to show that better, because this distribution should not look like a barrier when it comes to a lot. We should, hopefully have a better sense of the way that we're building communities, and that people know that they're individuals that we care about. Lesson 10 is we're not so bad at getting the amount of social connection we want, but on average, we want more than what we're getting. And so these spider plots are a good way to show this. If you look, the darker orange is how much social connection they got over the past 3 months. And then the lighter orange is how much they would like to be spending. And you can see that overall, in terms of the number of people that they interacted with, they're pretty satisfied. People are pretty much getting as much social connection they need on each of these. We do see probably lower levels among close friendships. So people are actually getting less than they want. Casual friendships, they're actually getting less than they want. But overall, we're not so bad at getting the amount of social connection that we say we want. Similar when it comes to the amount of time. So this was the number of individuals. This is the amount of time. We see that we want to be spending more time than we are with family. And this is in number of hours from 0 to 14. We want to spend more time with friends. But we're probably spending, we're satisfied. We're getting, if not more, time with our class workers, neighbors, acquaintances, and strangers. And so you see also this helps to identify where we want to spend our time. We want to spend our time with our family. our friends, and our coworkers. And so I think this is really interesting data, just in terms of understanding what people's preferences are. Then there's also the issue of what you're doing. And again, we track pretty well in terms of how we want to be prioritizing these things in our lives versus how we are actually prioritizing them. And so we look at a number of things like watching TV, work, using social media, socializing with others, exercising, socializing with friends, spending time with family. And you see, again, overall, we're pretty good at spending the amount of time and prioritizing the things the way we want to be prioritizing them. But again, we're just slightly missing the mark on average. And so I think, again, this highlights the critical component of that. Some people are really missing out on these things, but most of us are actually doing a pretty good job. And therefore, it becomes important for the rest of us who are doing good at it to think about how we create more inclusive and communities where people belong when they feel isolated. In terms of levels of community involvement, we see that generally people do have difficulties actually engaging in kind of the broader community. About half of people aren't involved in any sort of community, civic, or social organization. But there is a lot of interest for these. People want to participate in hobby organizations. Only 35% of people were not interested. 41% were interested but not participating, and then 22% were already involved in those types of organizations. So there's lots of opportunity for the third sector, for social and community organizations to find people, engage them, and have them be involved. And I think you can see that leans towards, things that people find meaning in, not necessarily things like political organizations or that sort of things, but I think people have different things that they like, and so I think it's important to offer lots of different ways for people to connect across communities. Lessons 12. So people are pretty good at getting the emotive social connection they need, but sometimes there are issues about anxieties, worries, stress, things that create a negative perception of social connection. And these self-narratives appear to be a really critical barrier. And so we asked people about their barriers to social connection. And we see that being an introvert, being worried about COVID-19, being too tired, social anxiety, being shy, afraid people won't like them, too anxious, too stressed. These are all things that people are concerned about. And a lot of these top reasons that people don't connect appear to be related to worries and concerns and mental health issues that really seem to be a barrier to social connection. There are, of course, other reasons too. Things like people live too far away from me. If you're in a rural area or you just don't have transportation to get out to friends, that can, of course, be a real, troubling barrier for people. It's too expensive. 15% of people said it was too expensive to go out and socialize. Again, one of the things we're seeing is that, okay, well, the things that matter most aren't the things that cost money. They're that individual time, just having a conversation, shooting the breeze sort of stuff. And so thinking about these barriers, I think it's really critical to look at this pathway that we mentioned earlier in terms of social isolation causing loneliness, loneliness causing stress, that stress increasing vigilance to social threat, and then that social vigilance causing you to isolate yourself. This is the cycle and feedback pattern that I warned about when showing this diagram before. And I think it comes up in identifying these barriers that people are talking about. So I think one of the critical things we must do is build social and look at social self-efficacy. So to understand what people are, how capable they feel. And so we asked a social self-efficacy questionnaire, and these are the items on the questionnaire. You see that on average, people are pretty confident in their ability to communicate effectively in social relationships. Yeah, maybe 20% of people or so are not that confident in their abilities to do those things. But overall, we're pretty confident in that. We're confident in our ability to maintain social relationships, to open up to others, resolve conflicts. Where we're really not appearing to be confident is approach people I don't know and strike up a conversation. It's this making of the new relationships that really seems to be a barrier. And I think that goes back to these same sorts of barriers that were identified. People are too tired, too stressed out, too worried about what people will think about them. And they're identifying as introverts as a way to kind of understand that sort of overall relationship. And that this is borne out when we just ask simple questions like, how comfortable are you talking with strangers? Again, a large proportion of people, roughly half, are neither comfortable or uncomfortable or less. And so people do have somewhat of a social interaction anxiety that does seem to be a critical barrier. And then when it comes to people's perceptions of how easy it is to get help, people say it's possible, but not a lot of people, only a third of people said it would be very easy to get help they need. Again, suboptimal, but something we need to look at. So lesson 14 is while people have a general sense of social health well-being being beneficial, many don't know to what extent social connection is important for morbidity and mortality. So looking at the perceived benefits of meeting new people, lots of people perceive, only 8% of people say, I don't really think there's any benefits to meeting new people. So those challenges that we deal with in self-efficacy of going out and striking up a conversation, it's not because we don't think there's any benefits. We clearly think that it helps us consider new perspectives. It helps us build a stronger social relationship. A third of people recognize that it improves their mood. And so I think that's really critical. So it's not necessarily a knowledge issue. And in fact, when we look at the percent of people who know that social connection is important to their mental health, 92% of people say they knew that. When you ask them if it was important for their physical health, 88% of people, just intuitively, that when you're connected and you're socializing with others, that those are having positive effects both mentally and physically. As you look at the extent to which people understand this, however, it certainly declines. So if you know that loneliness and social isolation are associated with higher risk for premature death, you lose about 20% of people. If you say, it's as bad as pollution or being obese or living a sedentary life or consuming alcohol, going back to that morbidity and mortality data, it basically cuts it in half in terms of the people that are aware of the extent to which social isolation is a problem. And I think this really is reflected in the way that we've developed an anti-human society that devalues social connection, prioritizing things like commutes and work and social media. And I think that's a really critical issue that we are now beginning to wake up to. As Beverly mentioned, a number of countries have appointed ministers of loneliness and are working to address this. However, outside of the United Kingdom, no other country actually has a comprehensive national strategy to address loneliness and social isolation. And so those individual health effects are going to continue to affect us, and it's also going to cascade into the societal level consequences I started with. In terms of interventions, we know that improving social cognition is really one of the most important things to do. So improve people's understanding of the benefits of social connection and how it can help. Of course, certain people need improvements in their social skills, they need opportunities for interaction, and they need enhancing in social supports. There are lots of different programs out there to design, but it's not entirely clear with the existing literature which of those interventions are actually best. What is clear is that we need a full system socio-ecological intervention, ranging from governments and health systems down to people like you and me, just individuals, families, and communities. And so as we continue with the Canadian Social Connection Survey, we want to develop out these guidelines and help Canadians connect to live in happier and healthier communities. And so that's really the aim of this ongoing work. And I'm grateful for the General Project, for the Institute for Social Connection, for our funders, the Canadian Institute for Health Research, SSHRC, the Public Health Agency of Canada, and our other community partners. And with that, I think we have a few minutes left, or maybe not. Maybe we don't have a few minutes left for for talk. But anyhow, I'll turn that over to you, Pete.
Thank you, Dr. Kiffer Card. 14 lessons. I think my head started to spin around 7 or 8. The amount of information that you just shared, and each one of them in itself was so powerful, Kiffer. And you could see the banter in the session that was really helpful in people having conversations about each of the insights. I know we could probably go into a 30-minute or 3-hour conversation around this, but we did get a couple questions in the chat. I know, let me just throw one at you here. So, and this is one about, again, there was a lot of banter in the chat that was really more about discussing versus the question. But one question came from Jamie Bauer, which is, we all know the negative social impact that social media or other tech has had on loneliness. Have you found anything that has been working to help create those deeper connections? So anything specific, but also, is there anything in the work that we've been doing that really speaks to digital and the role that it is playing to either disconnect us or, in some cases, connect us?
Yeah, a lot of my work in my PhD actually focused on this issue of online versus in-person connection and how that was impacting us as a society, particularly in a microcosm of looking at LGBTQ people. And I think there's a number of important lessons from that. First, we know that social online media doesn't necessarily have to be bad, but it's how you use it, right? Most people don't know how to build online communities. It's just not a natural skill that we have, and therefore we're not very good at it. I think also important is that a lot of people prefer online mediated social connection. In fact, if you look at people who are lonely and socially isolated, they use online media more frequently. Sure, online media use can cause loneliness and social isolation, but when you actually talk to those people, they feel more comfortable with that level of social connection. So for some people, if you can't get the in-person social connection, online social connection is a good second best. So but I think it is. I mean, our data really show that that in-person casual conversation really seems to have strong effects on loneliness. Whereas, like the more time you spend online, it doesn't really seem to be coming out from there. And so, I think we talk about there's this theory called media richness theory, and the more real life something is like, the better. So, video face to face is probably better than just text communication. In person is probably better than video face to face, right? So I think that's a really critical lesson is that you want things that more mirror what our bodies need, and our bodies need hugs. They need serotonin. They need neurotransmitters to be firing in a way that only happens when you're really face to face and able to interact and smell and taste and see other people.
Yeah, I think it's a great comment, Kiffer. And I think, even your gaming example in the habits that people had that made them feel connected. I had a little comment in the chat there just about as a supplement so that you go out and play with your friend on the street and then you go and play gaming together. That I totally get that. But if you're spending all day gaming and you never actually connect with that individual, I'm not sure those to me would be two separate things. Thoughts?
I mean, I don't know that I agree. I think if you have a great online community, my one worry is that community going to last? And are you going to find yourself that once you have a job and you don't have time for those games anymore, will you have the social skills? Will you have the social ability to replicate that sort of community that you built online in life?
Yeah, no question. So we're over time by 3 minutes, Kiffer. So I just got the heads up from the team. I'm just going to wrap by saying this was an incredibly powerful presentation. You can see it in the chat. People are all congratulating you on A, the insights, B, your presentation. So again, thank you, Kiffer, for being such a champion of building a human connection movement in this country and educating people about why we need to make that happen.
Yeah, thank you, Pete.
Cheers, my friend. We'll see everybody on the next session.